The next topic that we are going to study is about the infections of the central nervous system. Okay, infections, as you know, can happen through microorganisms. It could be a viral infection, it could be a bacterial infection, it could be a fungal infection or a parasitic infection. Okay, different kinds of infections are present. So these infectious microorganisms enter the CNS when the person has a trauma like head injury, after a fall, when there is a fracture, when there is open wound. Then the microorganisms can enter directly to the nervous system or the brain. At other times, it can be the focus of the infection can be in some other area, and the microorganisms can travel through the bloodstream to the brain and cause damage or infection. Commonly, we see that the central nervous system can be infected through meningitis, encephalitis, brain abscess, and cerebral malaria. Okay, we will see the first three because they are part of your syllabus. I don't want to confuse you with cerebral malaria. Let us see what meningitis is, encephalitis, and brain abscess. See, meningitis, the brain is covered with meninges. Okay, so meningitis is the inflammation. Itis always means inflammation. So meningitis means inflammation of the meninges. So the protective membrane which covers the brain and spinal cord are called meninges. So it is a membrane which covers the brain and spinal cord. When these meninges become when these meninges have infection, it is called meningitis, and there is inflammation of the meninges. So the cause of meningitis is bacterial infection, viral infection, fungal infection, or protozoal infection. So bacterial infection can be either pyogenic meningitis or tuberculous meningitis. So we'll see what bacterial meningitis is. Bacterial meningitis is the most common. Okay, so it can be caused by two organisms, S. pneumoniae and N. meningitis. So they usually colonize the nasopharynx. Colonize means they stay in that area. So they are present in the nasopharynx and they attach themselves to the nasopharyngeal epithelial cells. See, the nasopharyngeal or the sorry, I had a phone call, so I had to stop. So the nasopharyngeal epithelial cells are colonized by these organisms, and then from there they mix with the bloodstream and they can reach any part of the body, and when they reach the brain, they reach the choroid plexus and infect the epithelial cells there, and they also gain access to the cerebrospinal fluid. So they mix with the cerebrospinal fluid, and when they affect the meninges, there are certain signs and symptoms like fever, headache, and neck stiffness. Okay, so these are triads. It's a characteristic triad, we call it, because when these three occur together, we can say it is meningitis: fever, headache, and neck stiffness. See, fever and headache occur in various other infections as well, but neck stiffness is characteristic of meningitis along with fever and headache. So there are other symptoms that the patient can have. They can have nausea, vomiting sensation. They can also have vomiting, photophobia, which is fear of the light, sleepiness, fatigue, that is being tired, confusion, irritability, delirium, and even coma. So these are the other symptoms that occur with meningitis. What are the risk factors? Though we say the organism enters directly due to a trauma or through the bloodstream, there are certain conditions which are risk factors for this meningitis. So they are otitis media, that is middle ear infection of the middle ear. Then immunocompromised people, that is people who have reduced immunity. There are certain people like HIV patients, they have reduced immunity, and there are other groups of people as well who have reduced immunity. So those people are at high risk of getting meningitis. Then trauma, any injuries, exposure to drugs, recurrent meningoencephalitis or meningitis, people who have repeated history of meningitis. The organism does not go away in spite of the treatment, and it is present inside, and then it grows again and causes the infection. Then resection of acoustic neuroma can lead to this kind of infection. Any injections which into the subarachnoid space can cause this infection if there is any infective material injection into the subarachnoid space. So these are the risk factors which cause meningitis. So as we said, the next type of meningitis is tuberculous meningitis. The first one which we study, the bacterial meningitis, is also called the pyogenic meningitis. The next one is a tuberculous meningitis. Okay, tuberculous meningitis occurs in two steps. Mycobacterium tuberculosis is a bacilli which enters the body through droplet inhalation. Just like this coronavirus which we keep hearing about, it's a droplet infection, they say. It means through air it spreads. So same way tuberculosis, Mycobacterium tuberculosis bacteria also can spread, and it goes to the lungs, and from there in the regional lymph nodes, and some of these people develop tuberculous meningitis. Other people can have other tuberculosis of the other organs, but some people develop tuberculous meningitis where the bacilli multiply in the brain parenchyma or the meninges. Okay, this next step in this is that there is an increase in the size of the focus area, the area where the bacteria multiplies, and it ruptures into the subarachnoid space and it causes a tubercle. Okay, tubercle is it's like a collection of this bacteria which is like a focal area, and this determines the type of CNS involvement, because the place where it is located, that and the extent of damage, all this can cause differing symptoms in different people. Okay, so it can occur in small children also as part of primary infection, or it can be part of a miliary tuberculosis or a generalized tuberculosis. Okay, in bacterial meningitis we saw it spreads across the meninges, but here it is in the form of tubercles or millet seed sized tubercles which form in the brain parenchyma. Okay, and these can enlarge, and then they can release pus. They can cause a lot of damage by releasing pus in the area, and the signs and symptoms like cranial nerve deficits can be present. So if the cranial nerves are involved, then they can get damaged, and whichever cranial nerve is damaged, the corresponding functions may be lost in the person. Headache is very common. Then altered mental status, the person can have delirium, they can have fits like epilepsy, they can have vomiting, fever can be present, general feeling of weakness, they can also have depression, papilledema, oculomotor paralysis. That is, these are all, some of them are symptoms of cranial nerve damage. So this is the type of meningitis that occurs because of tuberculosis. Okay, next is viral meningitis, when the meninges get inflamed because of infection because of a viral nature, and this is a self-limiting problem, and there is self-limiting in the sense, it usually virus, it will come and enter the body, and then it will start multiplying. The number of virus multiplies, and if the body has good immunity, then it can be corrected on its own. The virus can be killed and the body will overcome the infection. So similarly, the viral meningitis can be overcome in 7 to 10 days by the human body, but sometimes the meningitis the virus can lead to meningoencephalitis and meningomyelitis. Okay, so these are the ones which cause severe problems, and again the symptoms include headache, fever and neck stiffness. But here when you do a CSF examination, there is no presence of bacteria. So that is the difference between bacterial meningitis and viral meningitis. So when we do a CSF examination, there will be no presence of bacteria in the CSF. So viral meningitis is less serious than bacterial meningitis, but still it needs to be identified, and if persons have severe problems, they have to be treated. Otherwise, rest and bed rest and medications to treat the fever, and also antiviral agents like acyclovir will be helpful in overcoming the viral meningitis. So generally for meningitis we can do CSF test. We take the CSF and check for the presence of bacteria. So if we identified any bacteria, tuberculous bacteria or other bacteria, we can differentiate between bacterial meningitis, pyogenic meningitis, tuberculose meningitis and viral meningitis. And if there is fungus in the CSF, the culture will be positive for fungal infection. Okay, then a CT scan can show which are the areas which have edema, and if there is any effusion which is present. So CT scan is one of the investigations that is done, and MRI also helps to identify extent of inflammatory changes. We know meningitis is inflammation of the meninges, so when we do an MRI we will know the extent of inflammation in the meninges. So there are different presentations in the MRI, like there are cisterns and distension of the subarachnoid space. All this can help in identifying if there is any meningitis and the extent of damage. Then complete blood count is helpful for us with differential counts to find out if there is any infection. Serum electrolytes can be done, blood culture is done. The complications of meningitis is the person can have hypotension, that is reduced blood pressure, then hypoxemia, hyponatremia, that is lower level of sodium, cardiac arrhythmias, ischemia, stroke, and then any other chronic disease which is present in the person can be exacerbated. What is the treatment for bacterial meningitis? The person can be dehydrated, so they have to be given IV fluids, and their vitals have to be checked, and the patient has to be stabilized. And if the person has meningitis, they have to be immediately taken to the hospital. Antibiotics should be started to overcome the bacteria like gentamicin, vancomycin, augmentin. All these are useful for bacterial meningitis. Tuberculous meningitis, the treatment is the regular treatment for tuberculosis like rifampicin, isoniazid, and all these drugs, ethambutol, it's a rifampicin. So these drugs which are given as a standard dose for any tuberculosis, they are given for the person. And the liver has to be tested because people can have hepatotoxicity, and these drugs can cause increase in severity of the liver damage. And renal function test, electrolytes, all this will also help us to identify these problems if they are present. Medication should be complied by these patients with tuberculous meningitis, because one of the common problems with people, just like leprosy, we see that because it's a long duration treatment, they do not comply with the medications. They take the treatment and after a few days they stop taking the treatment. So they have to be counseled, and we should make sure that they comply with the treatment. Okay, and the standard management of tuberculosis is also given for tuberculosis meningitis. So with that we'll finish about meningitis. We'll see encephalitis and brain abscess in the next class. Thank you.